well-tuned Ferraris. And I'm just a mechanic in a certain sense. I can plug you in, and I know what's going on inside of you. It's fascinating. And everybody's genetics is different, everyone's blood is different, so you're not all the same, but we do all have similar characteristics. If you come in with a high hemoglobin A1C, you're typically pretty chubbed out, unless you're born with insulin deficiency, type 1 diabetes. And if that's down, I know you've lost a lot of weight. The typical thing when people come in and they watch our nutrition video, which shows them how to keep their insulin and sugar low. And some people they walk in the room at 230 pounds, 5'7", and they go, I do all of that. I follow that nutrition program exactly like that tape. And I go, no, you don't. And they go, yes, I do. And some people I have to sit for an hour with or so to get it through their head that they cheat all day long. How many of you are cheaters in here? Yeah. So one person I had came in about 2:30, and she was telling me about this. And I got pretty angry with her because she was taking a lot of my time. And I said, you are not following this nutrition. And if you want to change, because you're paying me a lot of money, and you came here for a reason, you have to get it through your head that you're not doing this. And she kept saying over and over, no, I'm doing it. But then crept out a little cheat. Oh, I just do that once in a while. By the end of the hour, all day long I found cheating. But she still said, and I follow that nutrition. Well, we didn't walk out on the best terms. I didn't think I'd see her again. She came back 3 months later, and she walked in the door like this. You didn't think I could do it, did you? She had lost 30 pounds. She looked great. She said, I'm still doing that good nutrition, but I'm not cheating anymore. So we have to be careful about the cheats. I'm pretty tuned into this, and I know if I can do it, because I'm a sugar-addicted person. I love it. But it doesn't need to get done. It's something you can train yourself into if you want to. It's important. It's going to help get rid of your pain. It's going to help get rid of all these risk factors that the big bellies I see in this room are carrying. I work hard at it. I know that. I know it's not the easiest thing for most people to just jump in to do. It's something you begin like anything else. You take the first step, and then you take the second step, and then you fall back a step, then you go forward 3 steps. So I commiserate with you. I've been on the path, but it's something that you learn how to do just like you learn how to use a computer. When you first get a computer, what do you go? I don't want to do a computer. That's confusing. But it's something to do. It helps you in your life. Even registered dietitians may teach the new food pyramid, but it's not the one that helps us. And I have people coming all the time. They go, I'm seeing my nutritionist. I'm doing everything great. And I go, well, why isn't it working for you? It's because these people haven't come up to date with the research that we know about today, which is all about if you want to live longer, and you type 2 diabetics here who raised your hands, you're going to live 7 to 8 years shorter than the rest of us, okay? Unless you change what you're doing. And I'm not saying that like fire and brimstone. It's studied. It's a fact. So change your food, you live longer. Those of us that don't have the type 2 diabetes, I'm not sure we're going to live longer, but it looks like that's going to happen. So here's what we're moving to. We have meat at this is the newer one. We're moving towards this, but it's still pretty much the old one, isn't it? Grains, vegetables, fruit, milk, and then finally get the protein in. So the challenges we have with the revised system, too much fruit for most people. Now some people get away with it. I can get away with a lot of fruit if I want to. It doesn't distinguish between high and low glycemic fruit and starches. So we say, some people learn about this. They go, well, carbs are bad. No, carbs are not bad. High glycemic carbs don't work for you. That's basically it. The low glycemic ones, get as much as you can. Typically a number, if you look at some of these websites on glycemic index or diabetes, you'll find that around 30 is the cutoff for where you want to be with different foods. Too high in dairy. Too low in protein. Incomplete proteins. A lot of nuts and seeds and beans, that's not going to do it. Too high in grains. The old format is a lot of dried fruit, 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 fruit. Go easy on the juice. It doesn't have the enzymes. It doesn't have the fiber. What does it do? It gives you a great rush, but it's raising up your glucose and it's raising up your insulin. What's that doing? Causing pain in the body. Remember, insulin is inflammatory. Stay away from fruit juice. Stay away from carrot juice. Carrot's a very high glycemic vegetable, but I drink celery juice. Alkalinizes me. I don't like the way it tastes, but I don't care. It does the job. I don't do food based on taste. I just don't. You know, the food I like to eat is too expensive for me to buy. This is a great study. Now, we know a lot about Aborigines, even though most of them lived a long time ago, because we've had societies of Aborigines up until present time. Africa, Aborigines in Australia, South America. What didn't they have that we have? They didn't have processed food. They didn't cook grain. They ran after their food and they ate it. So they had grass-fed beef or whatever animal they were eating. They were hunters and gatherers. They took stuff out of the ground, things that they could eat without cooking, so they didn't break down the cellulose. They had a lot of fiber. They didn't get the sugars out of their foods, you know, to eat them by cooking them. They didn't have, for the most part, diabetes. They didn't have obesity. They did not have osteoporosis. They did not have diabetes, heart disease. They did not have a lot of cancer. Now, albeit they didn't live that long anyway because they had a lot of trauma. They were killing each other, and they had a lot of infections. Okay? So they didn't live as long as we're living now, and who knows what would have happened. But when they rank up people with the cooked grains and all these things versus them at the same ages, these people did a lot better until when? Till we civilized them. So in a very short period of time, our nutrition has changed very suddenly with cooking, which was 10,000 years ago. Actually, it was cooking a long time before that. Supposedly, there's been cooking on the planet for at least 150, 200,000 years. But pulling the grains into the picture started about 10,000 years ago. And that's when a lot of these problems started. The reason is, and by the way, here's some of the groups. The Inuit, we know about the Inuits now because of Sarah Palin, right? Her husband was from the Inuits. You know, and they ate great. They ate a lot of, you know, fish and whatnot. So the fish has a lot of omega-3, which reduces inflammation in the body. But none of these really ate our diet until recently. But this is the big kicker. The food changed, but our genes didn't change, right? So what happens? Our genetics are not made for the food that we're eating. Most of us cannot tolerate the food we're eating. It makes us sick. It makes us, you know, inflamed. It makes us painful. It gives us autoimmune diseases. It gives us heart attacks. It gives us osteoporosis. All these things. It gives us cancer. So here we are changing what we're doing inside the body to the body, but the genes don't tolerate it because the genes are old, great genes. They work great then. They work great now if you treat them well. So the typical paleo rations: protein 20 to 35%, carbs 20 to 40%, fats up to 60%. How can fats be good for you? Didn't everybody tell us when we were growing up, don't eat any fat?
That's right.
Anyone here still believe it? I don't see any hands go up. But remember Barry Sears wrote the Zone Diet? It was all about, actually it was his later book on the eicosanoids and the right oils and the bad oils to eat. There's good fats. Yeah, fish oil is a good fat, isn't it? I eat avocados every day. Our refrigerator is lined with avocados. My office is lined with avocados. Why? They're easy. I can carry them around with me. I don't need a knife. I can just crack them open, shove them in my mouth. They're great for airports. You know, if you have a backpack, you stick a couple avocados in there, you're set. We have to be very, very careful of what the net systemic load of acid is. And this country is probably the highest in the world because of our wealth. We're able to just be on the run, work a lot, grab some processed food. Very easy to do. It's got all the bad fats in it. It's got all the bad grains in it. It's got all the junk in it. What does it